Hi, this is Paul Thomas at AAPS 2010, talking today with Colin Minchom of Patheon. And Colin, you have a significant new introduction of SoluPath. Can you tell us what SoluPath is?
Paul will be very happy to. Well, we recognize that there are issues in the industry with the ability to deliver poorly soluble and poorly bioavailable molecules. And we looked around and found that, like ourselves, many people offered different technologies independent of each other, and that when you wanted to figure out which technology was going to suit your molecule, people tended to take a scattergun approach. They could spend many a month and many hundreds of thousands of dollars finding out that technology A didn't work, technology B had a bit of promise, then there was technology C, and maybe they even had to get to technology D and screen through all of them sequentially before they found that D was the one that was likely to get them through to the clinic. What we have done is figured out which are the right technologies to put together in one package, and we have 5 in total, and then package them in such a way that we can screen very quickly and then come up with the technology that has the highest likelihood of improving the bioavailability for that molecule. And the way we approached this was we looked at particle size reduction, we looked at solubilization, whether it be lipid solutions or non-lipid solutions, and we looked at spray dispersions or solid dispersions. And between those 3 major areas of technology, there are some sub-technologies that we apply, and across the whole spectrum we believe that we can hit over 95% of the molecules and improve the probability of success in the clinic.
And this is really early clinical work that you're talking about here, correct?
This is indeed early. In fact, this can be done totally pre-clinically, where you screen the molecules or the powders before they get to the clinic for the first time. Or we also believe that we could help companies that have got to the clinic and found they're not getting the exposure they expected, and then improve that exposure by screening, as I just said, and getting them through the whole process and saying which one of those technologies is the right one. A key to this is not, hey, we've got 5 technologies, let's throw the molecule at each of them together. We actually have expert scientists, expert PhDs in the field looking at the physicochemical properties of the molecule and the powder before we even approach the different technologies to say, you know what, we know that technology A couldn't fly. For instance, if it's micronization, you wouldn't want to put a drug with a low melting point in there, it'll just gum up the works. Therefore, why would you even test that? So an intellectual exercise first through experts, and then applying the appropriate technologies to see which one provides for the best probability of success.
So you're getting very robust data very early on. How are you then presenting that data to the customer, and then how are you moving forward?
That's a very good question. First of all, we encourage all of our clients to put other formulations that we propose through animal PK testing. And we can then, if you will, rank order from our perspective, from the manufacturing perspective, technologies 1, 2 and 3 in order of rank. From the PK information we can find out maybe there's a different rank order. So from a processability perspective, Patheon recommends 1, 2 and 3 in that order. From a PK perspective, it's 3, 2, 1. And from a stability perspective, it's 3, 2, 1 as well. Well, if you notice, number 2 comes out sort of second best in many of those, but because it's the best compromise to get that molecule through into the clinic. And that's how we propose. We would provide a report that says processability, here you go, PK, here's the information, and stability, here's the information, here's our proposal, and Patheon can then put together the package to give you the clinical supplies.
And then once it's into the clinic, obviously you can continue to support that development and scale up if they prefer.
Absolutely. One of the key aspects to the offering is that all of the technologies that we have selected are scalable. They can all be scaled all the way through to the market should it be desired by the client, and should that molecule cooperate, if you will, all the way through the process. It's still got to get through the risky aspects of the clinical studies. Is it going to be efficacious? Is it going to have the right safety profile? But if it is, we can take any one of those technologies all the way through to commercial for the client. And that's really key. And what's also important is, clearly this screening process, which takes 4 months in our hands and another 1 or 2 months depending on the animal species chosen for PK, isn't going to optimize. We would wish to help the client get to proof of principle and then help them make the investment decision as to whether and how to optimize based on the proof of principle studies in the clinic.
So you're really doing a lot of studies and doing a lot of groundwork that maybe wasn't done in the past or wasn't done as in a detailed as fashion as might have been in the past.
I'd like to turn that a little bit. What we are doing is bringing it all together into one offering. The two challenges for the client are, if they approach 5 different companies, the question about how much is this going to cost is number one, it's how long is a piece of string, how much work we're going to need to do. That's number one. Number two, what is the probability of success? For any one of these technologies, the probability could range from 5 to 40% for any individual molecule. It's not 100%. So instead of doing these sequentially and applying a lot of, and putting a lot of data into each one of these technologies, instead of generating a lot of data from each one of these technologies, we generate sufficient data from each of the technologies to come up with the one that will provide for the highest probability of success. It's the information necessary for that stage of development. With any aspect of bioavailability, especially with BCS class 2, 3 and 4, there's no absolute guarantees. We think by pulling together all of these technologies, we provide for increased likelihood of success with a fixed price offering, and we're looking at 4 months of in vitro work plus 1 or 2 months depending on the animal species for PK. So we're talking about 6 months, fixed price, to come up with the package that's going to get you to the clinic. That's what we offer with this.
My last question will be, obviously this is a new offering, but you've probably had some communication with clients. What are they telling you?
Interestingly, we actually took the prospective offering to a group of consultants to the industry before we took it out there, and they were extremely excited to be able to offer this to their clients, because instead of having to go to all of these shops and contract with all these people, Patheon can bring it together under one roof, and we can help them help their clients get to the clinic as quickly as possible. And for those with in-house technical expertise, again, everybody is coming up and saying, wow, I'm really interested in this. Can you really do this at fixed price? Well, we're committing to do it at fixed price. We're not going to go back and say, oh, another 25%, please. Number one. And number two, can you absolutely guarantee 4 months? Absolute guarantee. This is development. There's no absolutes in this, but that's our target. We know we can do that. We've done that sort of thing in the past. And adding on the 1 or 2 months of PK, we can provide for the greatest probability of success in bioavailability improvement when you get back to the clinic.
Colin, thanks so much for joining us today.
It's my pleasure. Thank you very much.